Ladies and gentlemen, focus. We are talking about the back pain today. So we're talking about lower back pain, and this is a big one. This is a big one for trainers. This is a big one for therapists, and the reason is it's stupidly common. I mean, lower back pain is just pain in your lower back. That's pretty self-explanatory, pretty obvious. So what we're looking at is essentially the region between the rib cage here and the pelvis. Anything in through here can be classified as lower back pain. Most commonly, we have it deep in kind of this perispinal region, or this little bastard SI joint pain. SI joint pain, it sucks. That's that toothache one that you complain about, feels like you need to pop it, it'll go away, you're all better, blah, blah, blah. It comes back the next day. That one is awful. And lower back pain is really common. One thing that I have to run into a lot in clinic is clarifying to people that they're not alone, that it sucks and it's horrible and it's disgustingly common. I mean, Stats Canada shows that 4 out of 5 people, 80% of people experience lower back pain. It's considered to be the most common cause of disability worldwide, according to many sources. It's hugely prevalent in our society. And the neat thing is, again, in 85-90% of cases, I almost fell off my ball. In 85-90% of cases, there's no structural dysfunction apparent. Like, everything in here looks healthy. So we used to say that lower back pain meant you had a slipped disc, or that you had facet joint irritation, or that you had arthritis, or that you had a sprained ligament, or improperly functioning core muscles. And we found that doesn't really jive. We found that like 4 out of 5 people or more, when they go in to get scanned, have nothing wrong on their image. So what's actually causing this? Well, think about it. This is a region between your rib cage and your pelvis, 2 very stable regions of your spine, or your spinal column, and it's heavily unstable. It depends completely on the musculature around it for its stability. It's very, very mobile, and we need good movement control. And if we don't have that, our brain, our central nervous system is going to say, I perceive insufficiency of control relative to daily need. I consider that threat. I am giving you a warning, and it's a hell of a warning. The pain people experience from this is debilitating. This is one of the leading causes of sick days in North America, is freaking low back pain. And so we have these essentially insufficiencies of movement control, insufficiencies of control and awareness of range of motion, insufficiencies of strength and stability for resistance through those ranges, insufficiency for the ability to slow down, to decelerate, to speed up, to re-accelerate our rate of motion through those ranges at that resistance. So we have this insufficiency to meet our daily movement needs. And our brain says, okay, you need to know something needs to change. Ouch. You get a hell of an ouch. And so what can we do about it? I mean, we can educate movement. We can work first with reducing some of the spasm, because this thing will almost always spasm like crazy. And we can reduce some of that spasm and increase our range of motion. And what that often results in is not decreased pain, but increased range at the same pain. We can then work on adding more resistance control, adding more strength awareness. And that ends up decreasing that pain through that increased range. And we can work on increasing our ability to react and change direction, to move from one plane of movement, say flexing, to another plane like side bending. And that decreases that movement fear, that kinesiophobia in our day-to-day life. And we can overall educate that. We can take that average of 6 weeks of recovery time and narrow that down. We can take that average pain level that people often consider like a 5, 6, 7 out of 10. Like so painful they're vocalizing. And we can drop that. We can make it more manageable. Because 80% of the time, there's nothing wrong in there. This is all healthy. Your facet joints are fine. Your discs are fine. Your nerves aren't entrapped. Your SI joint moves sufficiently or as little as it's supposed to. There's some debate there. What we need is better awareness of what can happen in through here, better control over what can happen through here, better ability to use what can be used through here safely. And that'll drop the volume of that warning, and that'll drop the intensity of that warning, that'll drop the duration of that warning. And as that pain warning drops, our function increases. We're back on our feet, we're back at work, we're back with our kids, we're back with our pets, we're back doing what we love, and we normalize ourselves again.